Space divides bodies, not minds. His words. Think about that a little. Minds connect. Wherever you're from, whoever you are. We are from Rotterdam. A gateway to the world. Here, we connect. We reach out. We find common ground. We listen. Our university is built on that same mentality. Working across disciplines. Sharing knowledge. We are part of everything that surrounds us. It's what makes us good at what we do. How we come up with new solutions, new ventures and ways of entrepreneurship. We believe that science can help solve the great problems of our time. That our minds can help to make a difference. A positive impact. We're Erasmus University Rotterdam, making minds matter. space divides bodies, not minds. His words. Think about that a little. Minds connect. Wherever you're from, whoever you are. We are from Rotterdam. A gateway to the world. Here, we connect. We reach out. We find common ground. We listen. Our university is built on that same mentality. Working across disciplines. Sharing knowledge. We are part of everything that surrounds us. It's what makes us good at what we do. How we come up with new solutions, new ventures and ways of entrepreneurship. We believe that science can help solve the great problems of our time. That our minds can help to make a difference. A positive impact. We're Erasmus University Rotterdam, making minds matter. Space divides bodies, not minds. His words. Think about that a little. Minds connect. Wherever you're from, whoever you are. We are from Rotterdam. A gateway to the world. Here, we connect. We reach out. We find common ground. We listen. Our university is built on that same mentality. Working across disciplines. Sharing knowledge. We are part of everything that surrounds us. It's what makes us good at what we do. How we come up with new solutions, new ventures and ways of entrepreneurship. We believe that science can help solve the great problems of our time. That our minds can help to make a difference. A positive impact. We're Erasmus University Rotterdam, making minds matter.
I hereby open the meeting. Candidate Mbelu, I bid you welcome. You are appearing before a committee appointed by the Doctorate Board of Erasmus University Rotterdam to defend your thesis and the appended propositions. Before we start the discussion, I invite you to give a short introduction in which you tell us about the subject and aims of your studies and your findings.
Thank you very much. I have to thank everyone for the opportunity to present my thesis. My supervisors, Professor Hobsworth and Dr. Christopher Bonner, who has given me immense support and mentorship throughout this process. So my research embodies the ethical concerns, started the ethical concerns and design of AI-enabled health insurance platforms in Nigeria. Universal health coverage, as it signifies, advances equitable and access to quality and affordable health care. But over the years, Nigeria, just like every other country, still grapples with issues of out-of-pocket expenditure. Over the years, health insurance have been identified as a vehicle to advance this tenet. And for it to happen, AI and digital technology has also been seen as a mechanism to ensure that access to health insurance have been pushed towards both for formal and informal sector. But as we all are excited about the roles of AI and what it could play, but there are some concerns. That's why the study really pushes us to examine these AI systems, this digital system. How do we examine to ensure that it advances artificial intelligence ethically and advances the tenets of universal healthcare coverage? The objective of this study, basically, we're looking at, analyzing, examining the decision choices to influence the design of AI-enabled health insurance platforms. We're looking at how do we analyze the roles of diverse stakeholders in shaping universal health coverage, identifying the values and assumptions embedded within the algorithmic decision makings of this platform. We're also going to explore the concerns, on experiences and perceptions of marginalized people, regarding how AI is being embedded in these platforms. And it's led us to developing the research questions where we'll be looking at the roles of diverse stakeholders, how in shaping the quality of security and communication of health insurance system. We also looked at, what are the concerns of marginalized populations? Do they like this? How do they perceive these initiatives in advancing universal health coverage, especially in the using of artificial intelligence? And the last research questions, we looked at what kind of values get coded into the algorithmic set, in the design and the decision making of these platforms. Then we looked at the literature review, which, of course, we still looked at different conversations around Western values in terms of principles, versus African theoretical concept of Ubuntu and its application to different cultural contexts. It also, we looked at issues around digital transformations, how a lot of organizations and tech companies have been deploying digital platforms in Nigeria. And of course, looking at the core pillars, issues around governance and how AI must align in an advancing universal values of universality, equity, and solidarity. But of course, it also delves us into challenges, issues around legislative lag. AI is moving so fast. Our policymakers, are they aligning with how fast this digital technology is moving? Also issues around structural gaps, are they specialized regulatory AI platforms or systems that will really guide the implementation of these digital platforms? And then, of course, operational barriers, AI literacy. If we are saying that artificial intelligence will move towards advancing universal health coverage, are the populace literate enough to really understand how this works, how to operate it, and how to really, align, especially in the digital world that we'll find ourselves in? Of course, issues around platformizations. Are the companies looking at issues around profit? Or are they looking at more about well-being of the individual? And most of the time, these platforms are coded in such a way that it's really looking at more of efficiency and more of profit, but rather than looking at who are the users of this platform. And of course, the designer's role, which often are excluded because they have a huge role in playing and shaping how these platforms have been designed. And of course, issues around inclusive platforms. So this led us to the foundation, the theoretical and conceptual foundation of this. And we looked at different theoretical, ethical framework, philosophical frameworks, and we looked at utilitarian theories, deontological virtue and Ubuntu. But looking at the tenets of universal health coverage, which of course, it hints on issues around, efficiency, and of course Ubuntu, which also aligns with the African philosophy and cultural adaptations of people who will use this platform, we were able to really, move on with these two theories in terms of laying the foundation of this project. Then study design. What we did is, in the study design, we had thematic analysis, content analysis, and of course, inductive analysis. What we did is we had semi-structured interviews. We identified 2 focus groups, and we now strategize our groups, through purposeful sampling, convenient sampling, and non-random sampling. So we had the policymakers, the designers, and the users. And between these different groups, we deployed, especially for the users, we deployed in-depth interviews and also focus group interviews. Then our key findings. First, we need to understand what are the perceptions, what do people feel about universal health coverage, especially by key stakeholders in Nigeria. And of course, it still boils up to issues around inadequate funding and bureaucratic efficiencies within the Nigerian healthcare sector. It also still leads us issues around, civil society, mistrust in the system because, of course, probably because of how insurance have been played in the past, and issues around bias for healthcare platforms, and also people preferring to pay cash because hospitals prefer cash, and when you talk about insurance, it's quite very, people do not want to go through this process, and issues around inequality, because most of the time people feel that when you're paying through the digital platform, the national health platform, most of these guys, the organization find it difficult that it will take time to receive their funding. Then still perception around insurance. Then issues around automated harm, right? One of the responses from one of our data collections with a small low-income earner says, my wife couldn't get relief until they got it. And issues around automated response. When these systems are built to provide automated response, what happens? What if it does not come? Someone might die, where people feel that it's more important to stay on systems rather than, laying out on humanitarian grounds to really advance and provide affordable healthcare. And issues around trust in the system, which I've also looked at. People still find it difficult to really trust the system in terms of because when people don't trust the system, how do you expect that they will also trust the use of artificial intelligence, where they don't even trust that health insurance will work? One said trust was closely tied to employment benefit, because over the years, Nigerian government has grappled with the issues around, sampling of health insurance because of data issues. And most of the people who get to have insurance are people who have employment. So what happens to people who do not have employment? And these are big issues. So when you're talking about AI and digital technology, already trust has not been eroded on the platform. And how do you think that people will trust to use these platforms? Then AI and digital health for universal healthcare coverage in Nigeria. So the double-edged sword and efficiency, because stakeholders acknowledge that AI potential to make probably more efficiency, reduce fraud. But however, findings warn that efficiency alone will worsen inequalities. And here, one important conversation. The study reveals that algorithm exclusion and bias, saying that tech-savvy people who often have income, says that, the platform, the language they use in this app, are designed in big English. That was one of the response, because these are market women. These are people who English is not their language. And you're designing apps and digital platforms and artificial intelligence, and you're expecting that they will be able to align. And what happens, right? And that still takes us back to the ethical convergence of Ubuntu, that if we are designing frameworks, we should understand people's cultural perceptions, cultural aspirations, and then put, issues about language and also people's situation, contextual situations in designing these platforms. And this can also be seen in the design of language models, which Africa still, has so much issues in terms of having language models in design of these AI platforms to align with them. Then infrastructural realism. Contrary to the global hype, local stakeholders argue that the problem is not lack of technology, but lack of infrastructure. One respondent bluntly stated, I don't think AI plays a huge role. AI is not going to solve any of those problems. And also one of the conversation says that, she does not have a telephone, right? And they mentioned that you must have a telephone before you could access that healthcare. So what happened to people who do not have access to telephone? Most people, when they have telephone, they don't have electricity to charge those telephone. And when they have the electricity, there's poverty. They can have data to put on this telephone to really access healthcare. And then you're talking about artificial intelligence. How do we ensure that individuals like this are not often left on the margins, but rather ensure that people like this are carried along? And that's why we could see that the ethical convergence of Ubuntu, which says that technological proficiency should not occur to the detriment of justice and human dignity. And then the role of software designers in shaping inclusive and efficient AI-enabled e-health insurance system. Issues around designers. And I found this very interesting because when I had conversation with one of the software designers, AI designers, and one of the things they said is that, well, designers describe themselves as middlemen. They ultimately follow what the client wants, often sacrificing UAC principles for the client's business goals. And this often negates Western ideologies because most of these clients and technological platforms are being funded by Western organizations, Western companies. And what it tells that most of the time your data and information are not within the Nigerian system, and it becomes an issue. Then policymakers, technology is moving so fast.
Could you wrap up?
Yeah, technology is moving so fast, and you also need them, to align with the ever-growing technological innovations. Then scientific conditions that says that the novelty of this work is that we are combining the utilitarian theory and Ubuntu as a framework in designing digital platforms. And for civil society, designers, and healthcare providers, one of the things we say that there has to be co-creation. Everybody has to be at the table. You shouldn't design for the people, but you should design with the people. And then conclusion, AI-enabled health insurance can support universal health coverage, but only a robust and ethical safeguard. Nigeria faces critical AI legislation, so we have to have contextual legislations that meet up to the development of this digital platform. This thesis advances the novel AI ethical framework combining utilitarian theory, Ubuntu, to guide the context-sensitive AI governance in Nigeria. Thank you so much for your time, committee. I hand over to you.
Thank you for your presentation. You were just in time. I call now upon Professor Alcande, the University of Ilorin, to start the discussion.
Thank you very much for your presentation. My question is about your study area. Your title suggests it's Nigeria. Going into the methods is talking about Lagos State, and then further talks about Ikeja. Your findings is representation of what we have in Nigeria. That's my question. Over. Thank you.
Yeah, so thank you so much, Prof. In as much as most of our findings were within the Ikeja region, we were able to have some individuals who also weren't in Lagos, and we're also in different parts of the country that we are also, especially stakeholders that were also indirectly working for the government. We were also able to collect, data and from those individuals. Thank you.
Is that a satisfactory answer?
Yes, please. Thank you.
There is the opportunity to continue the discussion. You have a second question, please.
All right. Thank you. It's just about the inclusion. You primarily went for those who are marginalized. how do we then get the balance to get the views of those that are not marginalized, and then you make a conclusion that it is the marginalized that are deprived of the AI effect in health insurance in Nigeria?
Thank you so much, Prof. So our stakeholders were divided into the policymakers, designers, and also and users. When we get to the users, we were able to strategize them into both the gig workers, low-income earners, and also market women, right? And we chose this because we needed to really understand the core perspective in terms of access to quality and affordable healthcare, and also how its new initiatives, especially digital technology and artificial intelligence, really, align with those people. And also looking at the policymakers and also the designers, we also got their perspective in terms of how it plays out within their own context.
Thank you.
Thank you. The discussion will be continued by Professor Onye Mukwe from the Babcock University. Seems to be working.
Okay, I'm kind of waiting for my camera to turn on for some reason. Give me a second, please.
There you are.
Okay, awesome. Okay, doesn't look quite like I had hoped it would look, but I hope my voice can be heard clearly.
You look perfectly fine.
Thank you. Congratulations, Mr. Mbelu, on an insightful thesis and a very clear presentation today. My question is around your use of theories. I see that you have, looked at the utilitarian theory, the deontology, virtue ethics, and Ubuntu. And I think those are very interesting theories, in particular Ubuntu. But I'm wondering, do you think, especially given, some of your findings and some of the interesting conversations that we have and understanding the Nigerian context, that these were sufficient? Why the focus on these theories and not other theories? So, for example, when we talk about vulnerable groups, we're looking at disability, we're looking at the gender disparities that we have, and that in the Nigerian context, that those are those are quite strong factors to consider. I'm wondering, do you see your use of theories as inclusive? Are there other theories that you probably should have considered?
Thank you so much, Prof. Yes, of course. I think there are probably, some theories I should have also added to this work. But because this is, and of course, those are things, moving this work forward, those are, other theories I really want, other lenses in terms of the feminist lens, the gender lens, and as you have also mentioned. But looking at utilitarian theory, we also, use utilitarian because of the tenets of universal healthcare coverage, issues around, efficiency, and advancing quality, and affordable healthcare, and aligning it with also the general African perspective of Ubuntu as a hybrid and also a fusion. Because we also believe that, to me, I think there are more a kind of gives a broader view, right? And, going deeper into this work or taking this work forward, we can still go forward into looking deeper into, pushing it a little, stratifying it and looking at, different groups, and how it really appeals to them. So I think this is what I should really, consider, and it's quite exciting to see how these theories really play out, in terms of these different groups. Thank you.
Thank you very much, and I'm satisfied with that answer. I don't know if I have
Yes, you do.
If I have room to ask other questions.
Yes, you have.
All right, thank you. The other thing that occurred to me as I looked at your theories and the way that we have addressed AI, and I imagine perhaps others might have questions around this also, is, it's almost like we look at AI as an unmitigated good, and so on. And I think that that's something that you may need to probe. But going, further, from a practical perspective, I think that we have had significant changes over the course of time, and I know that you have, you've had some time to work on this thesis, and you probably started at the point where several changes had not been made. So, but I wanted you to respond to this, given some of the critical changes that have been made in Nigeria. So, for example, we now have mandatory health insurance at state and federal levels. We have laws to that effect, both at state and federal level, and we are seeing movement towards including digital health within health insurance. Where do you situate your findings, and do you find that this work still makes an appreciable difference?
Thank you so much, Prof. Yeah, very exciting, I think, because like I mentioned, my find is that it's moving very fast, and we are following the news on AI. It seems that every day some new innovations are coming out, and part of the issues we have, not just Nigeria, globally, is that policymakers and legislative arms are yet to really understand these platforms and to make, some laws that really align with how these digital and AI platforms are being, are moving. In terms of the gains in terms of Nigerians' universal healthcare coverage, goals and the progress that have been made over the years, I think where my research also plays a good role is issues around co-creations and collaboration. I think the Federal Ministry of Health, National Health Insurance Agency, Nigerian Data Protection Agency, and of course the Minister of ICI Communication and Information Technology. I think there has to be some good collaborations in terms of looking at how the AI and digital innovations are playing out within the healthcare sector. And I also have an opinion to say that we have to start looking at how do we start looking at contextual laws, right? The Nigerian Data Protection Law, and I know recently we are building an AI strategy, but I think we have to start looking at what to say, how do we start looking at contextual artificial intelligence or digital laws that play for digital sectors. We cannot use generic frameworks or generic laws for different industries, and especially a very sensitive sector like the healthcare sector. So I think my work plays a very, very important role in terms of, looking at co-creation, getting stakeholders together, and most importantly, having a fusion of policymakers, designers, and of course the users, to really decide how AI and digital technology should play out in terms of this platform. Because at the end of the day, people will use this platform. So I think the research that organizations do are not enough, but there has to be a deliberate effort to carry people along. Thank you very much.
Thank you. That's an excellent answer. Thank you.
Thank you.
Over from my end. Yeah.
The next question will be put to you by Dr. Bunnick, Erasmus University.
Dear candidates, good afternoon.
Good afternoon.
I would like to congratulate you on having reached this milestone, important milestone in your career. While I was reading your thesis, I was grappling a bit with finding a clear description of the core aim of the study, but I did find it. On page 166, you say that the thesis evaluates the extent of health insurance usage in Nigeria and assesses the performance of universal healthcare by examining the adoption of AI-enhanced e-health insurance platforms. And I was thinking, You mention in your thesis that despite the National Health Insurance Authority bill having passed in Nigeria in 2022, that only a minority of the people in the country are covered by health insurance. You mentioned different numbers, 3%, 5 or 10. And I was especially struck by some of your empirical findings. One of your respondents says, I've never really seen people like me using it, health insurance. But I was wondering, does your thesis answer the question about the extent of health insurance usage?
Yes. If you look at the first pages of my slides of my findings, where I started off with the perception of health insurance, within the populace, to really understand how people think, what do people think about healthcare insurance? Do they have it, right? Do they use it, right? And because you have to get to understand whether they have this health insurance before you go to say, where do you buy? What platform do you buy? Where do you access? And it's just like the normal story to say that the conversations are still, people do not have access to it. People need to have formal jobs to have access to it, right? And I remember one respondent also saying that, they said before I could enroll that I need a smartphone, right, to get me enrolled into the system. And this further pushes issues around inequality and issues around infrastructural and poverty issues within the system, right? That, AI, artificial intelligence, digital technology is good, but we have to start looking at people who their voices are often left in the side margin, and people who want to purchase these things, but they don't have probably the education or the technological means to do that, but we'll have to find a way to go to their level so that they could assess this. And, I've seen conversations where people say that Africa, with the number we have in Africa, that mobile technology and this technology and artificial intelligence, has a full, potential to improve access to healthcare. But I beg to differ, because there are a lot of issues on ground, because when the country still have some issues around technology, infrastructural, especially at the grassroots, we have to start looking at the deeper problems. And that's why I propose a fusion of Aristotelian theory and Ubuntu theory, looking at understanding people, understanding their cultural aspirations. What are their situations like? And why aligning it with, of course, the issues around efficiency, which is a general, route. And that will help us to design a framework that will align with the goals of these people. And I think that gave out the answer to that question. Thanks.
You nicely make a bridge to my next question, if I may, because you prioritize utilitarianism and Ubuntu.
Yes.
In your thesis, but I was thinking your subject of study is that universal health insurance, universal health care. Mm-hmm. But to me, that sounds like a deontological instrument, actually, because it's focused on providing healthcare for all Nigerians. And I was wondering whether that wouldn't maybe have been an alternative theory that you could have used, or to ask the question in a more constructive sense, what do you think is the specific added benefits or the specific value of taking an Ubuntu perspective, an Ubuntu lens to this?
Thank you so much. In fact, I've seen something right now, because I understand, because of issues around rights, and duties. Of course, healthcare is a human right, right? Everybody deserves access to quality and affordable healthcare, right? But we still, move on to understand that we also need to really look at issues around utilitarian, because utilitarian also aligns more with issues around access to healthcare and universal health coverage, and also has a very solid background within the medical field, right? And also aligning it with the Ubuntu really gives us a perspective of co-creation, community participation, cultural aspirations, and all that. Because in as much as you talk about universal health coverage, health insurance is a vehicle to advance universal health coverage. And when you're talking about health insurance, you're talking about co-paying, because people need to contribute money into the pool to access health insurance, right? And for you to do that, you need coalition, you need community acceptance, you need people to really understand the purpose of this. You need the buy-in, you need the alignment with different stakeholders. And that's why I say the fusion of this framework will guide the design of these frameworks to ensure that we are achieving the purpose of the cultural aspiration of the Nigerian people, African context, and at the same time not throwing away the global, not really global, but the basics of healthcare access, and then the tenets of efficiency in advancing affordable and quality healthcare.
Okay. I'm looking at the chair. Yeah. In your concluding chapter, you mention 3 sets of concerns, ethical concerns: privacy and bias in the algorithms, and then human oversight. I couldn't really gather from the text there whether these were the result of your empirical study or whether these are in fact issues that are maybe already known from the existing literature, or what your study specifically adds to our, let's say, knowledge of the relevance of these concerns in this field.
Thank you so much for that question. Looking at the issues around, this you've also raised, we've had issues around having that platforms are designed, for people, right? And I remember one of my data collections and one of my conversations with one of the stakeholders. She said that when she was feeling, trying to log into the platform, that they were asking too much personal questions, right? And that really stopped her from, going forward with, using this platform. Already, you can understand by the inception of this work that already there is a mistrust within the people and the government, right? And in terms of previous health insurance schemes, right? And when it didn't work and people co-paid and probably they couldn't get access, or when they got access, they couldn't get what they want. Already, it's been kind of mistrust, right? And what it does that using these platforms, when people see questions like this and issues like this, it's kind of very, very suspicious. And issues are algorithmic and issues around bias and design of this platform. It also shows that, the designers and the policymakers, the designers especially, mention that we design based on the client's expectation and the client's goals and needs. We don't know what the client wants. We don't know, and especially in a non-regulated environment for artificial intelligence, like a porous place like Nigeria, right? We have the data protection laws, right? But at the same time, when the client expectations are being given to say, I want you to do this, I want you to design this, it's only between the client and the designers, and we don't know what that means. That might mean maybe ulterior motive. We don't know what their plans are. We don't know how this kind of they want to generate and how it affects the users. So, but putting the Lego frameworks to really put all these things in check.
I think our time is up.
It is. But the discussion will be continued by Professor Wallenberg, Erasmus University.
Thank you, and also thank you very much for your very fascinating thesis. And I'd also like to congratulate your supervisors here and your family, probably online, and your friends here in the room and online. So congratulations on this very important achievement. And also thank you for participating in the discussion. And well, I prepared some questions, and they were mainly about it. I thought you weren't that critical about the use of AI and technology, but I have the feeling now in your presentation, also in your answers today, you are a bit more critical than I got from the thesis. But I have one more specific, so I will leave out some questions, but I have a more specific question about the role of health insurers and AI. Because when you want to give this more important role to the health insurers and the use of AI in platforms, like you also explained in your answers, and they will use like large data sets to determine probably then which clients they want to help, but maybe also, and that we know from the Netherlands, about risk selection, for instance, which clients they may want to prefer to insure. or to steer decisions about which treatments are accessible in order to contain costs. Like, those clients we can help and maybe we don't want to insure them, or when we have to insure them, we will make sure that we don't have to pay for all the costs, so we can steer on what treatments they get. So I think when you introduce more of those technologies, you give insurers more of the chances to steer in that way. So I was wondering, as you are a bit, from your thesis, seem to be very much in favor of this. From a health insurance perspective, I would be in favor of, as a health insurer, but less so when you are studying it and want to protect the citizens. So how do you see this? How do you think health insurers can use this, and how can you also protect citizens against maybe misuse from their perspective?
Thank you so much. In part of my findings, I feel that the policymakers and the legislators are not up to date with technological advancement. Like I mentioned, it's a global issue. It's moving very fast. But I think Nigeria should do more in terms of how do we start putting out laws, and not just laws, contextual laws, right? Because I believe the general data protection laws that suffices for agriculture, finance, and education shouldn't be descent for a very sensitive field as healthcare, right? So I feel that it starts with the policymakers, right? And when we have the right policy, and in place, right, it trickles down to different sectors, and of course, sector like healthcare, and narrowing down to the health insurance sector, because I think that's where everything starts, from the policymakers, and that also comes to digital literacy and AI literacy. How do we ensure that those people really even understand what is happening, and how to really make that laws and put in place? And also issues around co-creation. We should not create for the people. We should not just create from a client's perspective, but how do we create in such a way that we co-create with people that will use it, and people that will design, and key stakeholders. Because at the end of the day, it's a win-win, because people trust your product. They use it, right? Because they feel that their data and information is protected. Thanks.
Maybe if I can ask a follow-up question, because of course I would immediately agree with you, but what you see in the struggles, like in your country, but also here in the Netherlands and in Europe and the US, we are of course struggling with that. So we're trying to make those laws to protect the people who use it, but at the same time we see how companies, but also governments, are very smart to see, okay, but how can we make it to our own benefit? And that those making of those new laws go very slow, while we'll see those tech companies act very fast. So I would immediately agree with you, but what do you think is needed to be able to reach this? Because I think it's also very difficult.
Yeah, so coalition building and civil society, right? So this is where the role of civil society comes in, right? The civil society has a strong role in terms of advocacy and getting people to understand the issues, right? And giving the people a voice, right? Because when there's an advocacy, civil society understand the issues within this field, academicians like us are putting it out there, it then becomes an issue. Governments start looking at how do we start putting laws in place to make this happen. And that's why you could see on my recommendations, I clearly stated that the civil society organizations have a strong role to play in terms of advocacy, because the way artificial intelligence is moving now, if nothing is done, the kind of inequality we are seeing, especially in countries like Africa, when most of the language models are not included in design of this platform, will be like something we've never seen before, and something needs to be done urgently.
Would that also mean that you have in Nigeria now new chances to develop this? So that we may say, well, maybe in Europe we have been too late, but now that it's being built up in Nigeria, you have new chances? And if so, what would you then recommend? Like, because you're now the expert on this. So.
Yeah, coalition building, getting the players in the room, right? And working with them to really understand the issues. And that's why research like this is so important, because you have to present in different forums, policymakers, people to really understand, the essence of this work, and while, the recommendations has to be taken. And most importantly, working with diverse stakeholders and carry them along, to see how we can develop, laws that are, people-centric, that really works for the people. Thank you.
Thank you. The discussion will be continued with Professor Bol, Erasmus University.
Thank you, dear Rector, and dear candidate. Also from me, congratulations for your this accomplishment and this great work. It was very interesting to read about the development and application of e-health and AI in Nigerian healthcare. I have also, of course, a couple of questions, and actually following up on the last one, I should say I'm not an ethicist, but I was very interested in your use of ethical theory, and I was also especially used actually in your use of Ubuntu. And I have two questions related to that. One is, so it seems to me that you now sort of prefer utilitarianism and Ubuntu, but to me, they seem radically opposite. So utilitarianism is focusing on efficiency, it's market-based, it's very individualistic, etc. And Ubuntu is communitarian, it's relational, it's so this, and you sort of seem to see them as sort of, if you combine them, then we have, the great ethical theory. And I was wondering how that works for you. And maybe also in relation to that, also in sort of the Nigerian development of AI. So would it be possible to develop an AI from Ubuntu philosophy? Would it be possible to develop AI that is communitarian, relational, that builds societies rather than sort of divides populations? So, yeah, these are sort of speculative questions, but I was truly interested in your answer to them.
Thank you so much for that fantastic question. Yes, I totally agree with you, and that's why I called it the novel part of this work is a fusion of these theories, right? Over the years, I think utilitarian has been played as, because it has a basis in healthcare. And of course, most people apply because at the end of the day, and healthcare needs a utilitarian theory because you need efficiency, you need quality healthcare, you need access, right? But at the same time, I felt that with a fusion of looking at local context, and this is Nigeria specific. If you're applying it in, let's say, in Canada or in North America or Colombia, Mexico, the theories will be different because you have to also understand the theories that play out in the community and people that these theories will be applied to. But within the African context, we like to, work with our neighbors. We like to knock in our neighbor's house and ask for water. We like to go and ask for food. There's a lot of, and if I get home and I have no one at home, I'll just, call my neighbor and then she gives me food to eat. So we are communal in nature. We understand issues around, community, culture, and together. And I felt that, for us to using not just looking at issues around the efficiency, but we have to see how we could really merge it with also understanding with the cultural aspirations and issues that are language and situations of people and communal setting, and merging them together will give us a solid hybrid that will help us design contextual ethical frameworks for the Nigerian setting. And I also love the question that you put through in terms of looking at issues around should we build platforms or AI platforms that will have some Ubuntu undertone, right? And thank you so much for that. And that is my vision, and those are things I really want to really propagate as we move forward to say designers and people who are building platforms shouldn't just build, right? This is a role of philosophers. This is a role of humanities, because now we have to understand the role of these theories and how they play out on where these digital platforms will be used. And of course, in the Nigerian setting, this is something that could be done, where we could use this theory and frameworks to guide designs of this different platform. And that way we are building for the people and not just for making money. And
and we've been discussing this on the table already, so your position towards AI, but I was also wondering, because your thesis actually shows that, to me at least, that AI certainly has all kinds of possibilities, but it also that the conditions for developing AI and using AI within Nigeria, or maybe even sub-Saharan Africa, or maybe even lower middle income countries, I don't know how great you could, are not that good. A lot of people don't speak English. They don't have access to healthcare in the first place. There is, a lack of data infrastructures, etc., etc. And so I was wondering, so if I were a policymaker in Nigeria, and I know that there's, I don't have a big budget, would I put it in developing AI, or would I put it in, hiring community health workers and setting up healthcare systems across the country? So how is that in terms of priority?
To save lives. Priority is to save lives. What the use of technology? If technology cannot save life, if technology cannot do what technology is meant to do in terms of saving life, what's the essence of building an AI platform or digital platform where the local villagers can't really use it, or don't really understand what it works? So I think we should go back to basics, right? In as much as we're excited about artificial intelligence, we should also understand that we should do what is important, community health workers, what we could lay hand to make sure our women give birth safely, we reduce the maternity mortality rate, and keep things going, as we also building laws that can really support the building of this platform, and also the infrastructural, deficiencies are being put in place, So I think it's something that could work hand in hand, but most importantly, we should save lives, and we should get, real people to do the work.
Thank you so much. I give the word back to the rector.
For the next question, we'll turn online again. Professor Binder will join us, Erasmus University Rotterdam.
Thank you. Dear candidate, let me start by congratulating you to what I think is a very interesting thesis on a highly timely topic. My question follows a bit up on the last cluster of questions that has been asked already, referring to what I think is really one crucial contribution of your thesis, namely to adopt a mixed ethical framework to look into the advantages and limitations of digital health governance in Nigeria. Specifically, as it has been mentioned already, you focus on utilitarianism and Ubuntu, and you highlight what I think you call on page 183 and chapter 5 more generally, the kind of constructive tension between utilitarianism and Ubuntu on the other hand. So in your answer to the last questions, you already emphasized some ways how these two theories can complement each other. However, I would be more interested in the tensions you identified, specifically through your work. So the first part of my question is, could you give us one or two concrete examples of tensions between these two classes of theories that emerged out of your research?
Thank you so much. One of the tensions that really, and especially in issues around findings and also my, generic data collection, is that you could see where one of the respondents says that the app that they say I should use has big English, right? Meaning that those are probably, of course, those are local market women I had conversation with. Their main language is not English, right? And you could see how this theory plays out, because if we're really looking at the Ubuntu communal collaborative, setting, these are things that can be tracked before building these platforms, because I have to understand that people I'm building for understand their situation, understand what they speak, how they think, what works for them, right? And then that will help me to align this, products or initiatives, with them. And in terms of efficiency, one of the tensions that also, highlighted was that, organizations were more interested in using emails or digital platforms to have feedback loop in terms of access to healthcare, right? And personally, I've also experienced this, that I've gone to hospitals in Nigeria and probably because there are some info automations I need to have in my app, right? And if that doesn't come, nobody will look at you, right? And They want to have efficiency. They want to cut costs. They want to make things faster by using these digital platforms or probably AI platforms that have some LLM or language models written in them. But really understanding the context situation within the Nigerian sector, that probably there might not be constant electricity like we have here in the Netherlands or have in Canada, or maybe the network, the internet is not trustworthy because it's working now and next time it doesn't work, right? And you could see that these are huge, tensions, right? Because life is on the line and because they are sacrificing efficiency in the altar of instead of looking at issues around humanity and saving lives. So these are the core tensions, right? But at the same time, we also understand for us to produce quality and affordable healthcare, there has to be, the utilitarian is still needed, right? To really ensure that healthcare provides a quality product, which of course we need it at the highest level. That is why we say there has to be a fusion of these, especially in a context-specific situation like Nigeria that speaks to the people, speaks to the culture, speaks to the situation, and speaks to the context in which these platforms have been designed and deployed. Thank you.
Thank you. That directly leads to the second part of my question. So when it comes to the policy recommendations you give in Chapter 5, you seem to then specifically focus on such a context-sensitive approach that you now already mentioned in your answer, and that I think dates back to your broader vision that you mentioned in the answers to other committee members. And so I would be here very interested in how this could look like in concrete terms. So could you give us some concrete examples of how this, what you call grassroots or bottom-up approach, could work in order to foster these values underlying Ubuntu, so social solidarity, community well-being, etc. So you mentioned some aspects already before, but could you make that a bit more concrete? Like imagine that I am one of your stakeholder groups, a designer or a policymaker. If I ask you, okay, what follows from your thesis? If I can take one step, what should that step be?
Well, coalition building, right? Because in my past life, where I've worked before, when I have worked issue within the, getting people to enroll in health insurance, what has worked was that we developed messaging in community languages. We have community forums where we have people come together, let them know how this works and the role and why we need them to work with us to make it happen. And it worked, enrollment, wrapped up in those areas, because they understood the situation. They also understood that now you have to trust us. Look at the systems, look at the laws that are put in place to really protect you so that it's not like stories before, like when you bought insurance and you were never able to have access. We could replicate things like that to say, if we are building technology, if private organizations and are building technology, how do we ensure that those technology are built with the people, right? Have forums where you have these people. Have forums where you have them give their voices. Have forums where you have them to understand their needs and aspirations, right? And this not just concentrating on normal research, business or product research, for your product, but more on also understanding the users and not just users, but in depth of people who will use this product and build coalition. And I tell people at the end of the day, it's a win-win because you're building trust, you're building a product that people love, and at the end of the day, it's also a profit for your organization because when people trust you, they stay with you, they use your product because they believe that their data, information, and privacy is being protected by your organization. Because there we are carried along from the inception of that design of that product. Thank you.
Thank you. One question to the chair. Do I still have time for a brief follow-up?
Please continue.
Great. Thank you. Thank you. So based on what you just said, are there any lessons that we can draw from your thesis concerning the more general setup of a healthcare system? So I'm now, for instance, thinking more of a state-based or a market-based healthcare system. So this goes already a bit beyond your thesis, but are there any lessons or advice that results from your thesis, both for policymakers and the Nigerian system, but possibly also for, let's say, the Dutch system, if it were to take Ubuntu values into account?
Yeah, so I think one of the major stories is And I tell people that we are the rise of AI etheists and philosophers. This is the time now because they are needed so much now. The future wouldn't just be designed by software engineers, but also philosophers who play a huge role in understanding the perception, the cultural aspirations, and the philosophical concept in deployment of this product. One major thing is I say in this work that I've gone in a lot of international forums. And the conversations have always, Africa has one of the largest world young population, right? And the mobile phone penetration and digital penetration is so high. But nobody asks if those phones have data. Nobody asks if those phones have electricity to charge them. Nobody asks if those phones are charging. So, and that brings us to the issues of when you understand context to say there are still a lot of nuances, infrastructural deficiencies in issues and backgrounds, and if you look at these things, this will help you to really tailor whatever initiative you have for any particular group, and not just Africa. I think generally around the whole world, And that's why frameworks are so important, because the more you understand ethical, have ethical lens and frameworks of people, it also helps you to understand how to best to really deal and relate with them. Thank you.
Thank you.
Thank you. I understand Professor Wallenberg has another burning question to put to you.
Dear candidate, we just got the list of propositions, so my eye was caught on proposition 11, so I may ask one of the paranyms to read it out loud and then ask a question.
Ethical silence in design in digital health is as dangerous as technological failure.
Yeah, thank you so much. I think a very interesting and a very good proposition, but it also, of course, raises a question, because I thought, okay, I couldn't agree less, but how can we improve the ethical voice? Because, of course, you're completely right, but it's also, we've tried a lot, but how can we improve it then? What would be your suggestion?
Thank you so much for that. Advocacy and strategic communication. With the atheists and philosophers, we shouldn't stay at the background and the university. We have to now communicate this at the outside world. And one of the things I've also done throughout this thesis, as I was rounding up, I moved to Canada with my family. And as I was rounding up, I was like, we need to bring people who designed this platform in one room. And I started an organization called the Ottawa Responsible AI Hub, because, of course, that's where I moved to. And for the first time, we were able to bring designers, policymakers, and users. For the first time in Canada, over 500 attendees in one room to discuss about AI ethics and responsible AI. We have players like IBM, have players like Microsoft, have players like Google, have players like people who play an active voice. And we also had the people in the room. So the conversation really brought out a lot of nuances to say that if we keep silent on how technology is moving, then there is a problem. So this is a time that atheists and people and philosophers will trust more on advocacy, strategic communication, convergence of players to deal them to understand that this is a time that we need to start building in terms of looking at the ethical framework and how these platforms are being built and being deployed. And the outcome of those output, because we had the policymaker from government, we were able to design some recommendations, and that was sent to the Canadian government. But already on the Nigerian side, we've already started a non-profit in Nigeria. I've not been there for a while, but of course, with these outcomes of this research, we'll start seeing how we could start building coalitions, and I'm sure you could see roles like AI ethics, responsible AI manager. These are things that are coming up now to show the ever important role of ethics in advancing digital technology, not just in healthcare, but in all sectors.
Do you think that it also requires something extra from ethicists? So it's important to bring those people together and all these stakeholders you just mentioned, and that ethicists are a very important role. But does it also require something from their knowledge or how they bring their knowledge across? So can it also be improved in your thinking?
Yes. I think, like I mentioned, strategic communication, right? We are in the era of TikTok, we're in eras of social media, we're in era of this. How do we now translate research, philosophical research in such a way that the Gen Zs and the new people within do understand this and understand how it's being applied? Sometimes the way you communicate things maybe 10 years ago, a lot of things have moved forward now. So theories has to move from not just theories, but to practical and implementing theories. So organizations can also see the importance. And I'm also glad they're seeing the importance because these roles are emerging. People are being employed in these roles. Atheists are given a voice, and this is what we desire and what we want to achieve. Thank you.
So it's really also very much about translating.
Dear candidate, the time allotted for the defense of your thesis is over. The committee will now withdraw to deliberate. Would you please wait here until we return? Adjourn the meeting. I reopen the meeting. Dear candidate, the Doctorate Board of Erasmus University Rotterdam, represented by me, has considered your thesis. Having heard your defense and the advice of this committee, I grant you the title of doctor. I authorize Professor Zwart to bestow this degree upon you in the customary manner.
Thank you. It is indeed with great pleasure that I undertake the task the Rector Magnificus has allotted to me. By the authority invested by law and according to the decision of the Doctorate Board of this university, I hereby confer upon you, Somto Onechi Mabelu, if I pronounce your names correctly, the doctorate degree. Do you promise to continue to perform your duties according to the principles of academic integrity, namely honestly and with care, critically and transparently and independently and impartially?
Promise.
As a testimony and proof thereof, I present you the diploma signed by the rector, the promoter, the co-promoter, and the other members of the committee here, and endorsed with the seal of the university. Congratulations.
Thank you so much.
Thank you. Picture.
Right here.
Mm-hmm.
Thank you.
Thank you. Having performed this task, I now take the opportunity to congratulate you on your achievements. Also, on behalf of Dr. Christoph Brunner, it is a great honor for us to be the first to address you, Somto Mabelu, as Doctor in Philosophy. Your thesis results from a courageous voyage onto which you embarked on the 16th of December 2019, when you indicated you're interested in pursuing a career as an external PhD researcher at our school, Erasmus School of Philosophy. You had already attained a number of degrees from the University of Abuja in Nigeria, but also from the Hague University of Applied Sciences, Communications Management. And your master thesis also already addressed the topic of universal health coverage in Nigeria. And you could also build on policy experience, for example, in the context of the USAID's Health Finance and Governance project in Nigeria, and later, more recently, you founded and coordinated the Ottawa Responsible AI Hub, ORA. And against this backdrop, your key ambition was to strengthen the ethical dimension, so to speak, of your very practical work. Initially, you approached our former colleague, Professor Payola Roja, to supervise you, and she involved me to address the ethical dimensions of your work. Initially, you addressed emerging AI applications from three ethical perspectives: utilitarianism, deontology, virtue ethics. But gradually you became also interested in involving Ubuntu in your analysis. And we also discussed that during the defense today. Gradually this dimension, this fourth dimension, became increasingly important. I must emphasize that your thesis was never meant to be a purely theoretical exercise. Your ambition was to make an impact on practice, so to speak, and that's, of course, in accordance also with, let's say, the ethos of our university. You wanted your work to be relevant and effective, tailored to the social, cultural, and economic realities of Nigeria, a country with a population of more than 236 million people, one of the I think the sixth most populous country in the world. So that's a big world out there where you work, and I think your work really is meant to have and is already having an impact. When Payal Aurora left our university, I became your supervisor, and Christophe Bruno became your co-supervisor, and thus commenced the process of intense reading, commenting, mostly electronically. So I'm very happy to welcome you alive in Rotterdam here. From the very beginning, you were a very committed and devoted researcher, a highly reliable candidate, very engaged with your self-designed projects, bridging empirical research, practical experience, and philosophical reflection, clearly oriented towards societal transitions. Contributing to the development of responsible AI for e-health in Nigeria. This highlights the possibilities of critical decision-making in health policy. Working with you was, for us, for Christophe and me, a very rewarding process. We learned a lot, and we came to appreciate not only the complexities of health governance in Nigeria, but also the importance of reflexive and open dialogue, understanding the motivations, backgrounds, modes of thought that shape the projects you were involved in. During the writing process, you were consistently very receptive to our feedback and criticism, concepts, comments and advice. And as I already said, your intention was to ensure that your thesis would have a meaningful impact on the Nigerian public health sector and the challenge of deploying AI tools in a responsible manner. During the final stages of completion, you undertook a life-changing step to relocate to Ottawa. In November 2025, there you initiated and hosted the first Ottawa Responsible AI Summit, putting into practice what you teach in your thesis, so to speak, bringing together leaders from universities, but also grassroots innovators, critical thinkers, policymakers, into one big event, and you already referred to it, of course, during the events. Your engagements, your spirit exemplify for us what a truly visionary philosophy can contribute to the world, and today we celebrate that achievement. Congratulations. Thank you.
Dr. Mbelu, I have the pleasure also, on behalf of the Doctorate Board of the University, to congratulate you on having obtained your doctorate degree. I now formally declare this meeting closed.